According to the dictionary, heart failure is defined as a condition in which the heart is unable to supply oxygen and nutrient-rich blood to the tissues and organs of the body. This is a progressive condition in which there is no cure in most cases. However, there are treatments and medications for the condition. Those most at risk are over the age of 65, African Americans, and women. According to the CDC, or Center for Disease Control, it costs about $30 billion per year in healthcare services to treat heart failure. It is also estimated that there are more than 30 million Americans living with heart failure. When you have a healthy heart, it pumps nutrient and oxygen-rich blood throughout the body to organs and tissues. It also pumps deoxygenated blood to the lungs for oxygen replenishing. Here's a picture of a healthy heart with a pattern of blood flow to and from the heart. The heart is made up of 4 chambers, 4 valves, muscle, and 3 layers of lining. There's an atrium and a ventricle on the right side and an atrium and a ventricle on the left side. The right atrium receives blood from the body, sends it to the lungs, where it's supplied with oxygen to go out through the body. The left ventricle receives the oxygen-rich blood from the left atrium and then pumps it out to the tissues and organs. There are 2 types of heart failure, left-sided and right-sided heart failure. The most common of these is left-sided heart failure. The left side of the heart is unable to produce pressure needed to push blood forward into the body. This causes blood and fluid to back up into the lungs. Right-sided heart failure means that the right side of the heart can't pump in an effective manner, and it causes blood and fluid to back up into the tissues and organs. Symptoms of left-sided heart failure are shortness of breath, rapid weight gain, swelling of the feet, legs, and ankles, fatigue, confusion, restlessness, a dry, hacking cough, anxiety, difficulty breathing, and frequent urination at night. Fatigue or weakness, symptoms of right-sided heart failure, fatigue or weakness, rapid weight gain, enlargement of the liver, fatigue, anorexia, bloating of the abdomen, increased heart rate, abnormal heart sounds, and swelling of the feet, legs, and ankles, also anxiety. There are risk factors associated with heart failure. Some we can control, others we can't. Coronary artery disease, high blood pressure, diabetes, smoking, obesity, heart valve disease or heart defects, having a heart attack, alcohol and drugs, taking chemotherapy, and a family history of heart disease. There are things we can do to lower our risk of developing heart failure. The most common causes of heart failure are coronary artery disease and high blood pressure. A heart-healthy diet is a great way to lower risk of heart disease and heart failure. This includes things like lean meats, whole grains, fresh fruits and vegetables, and low sodium and sugar. Keeping high blood pressure under control can actually reduce the chance of developing heart failure by as much as 50%. We can stop smoking. The American Heart Association recommends 150 minutes of exercise a week. Simple things such as parking further away from the store helps, or sit less. Keep diabetes under control, do not take drugs, and no alcohol in excess. When things are out of our control and we are diagnosed with heart failure, there are still ways to make living with the condition easier. Alternating activities with periods of rest. Do household chores sitting down when possible. Avoid stress. Use your assisted devices when needed. Avoid those with any kind of infection, colds, and flu. Weigh every morning and monitor blood pressure daily. Limit amounts of fluids you're drinking. Eat healthy. reduce salt intake, develop a healthy sleeping pattern, and keep all doctor's appointments and take medications on time. According to the Cleveland Clinic, there are symptoms of heart failure that need immediate medical attention. If you have a weight gain of 3 or more pounds in one day or 5 pounds in a week, contact your doctor. Also contact the doctor if you have stomach bloating, the need for more pillows at night, new or worsening shortness of breath at rest or activity, increased swelling in the feet, legs, and ankles, worsening cough, nausea, vomiting, or decreasing appetite, and increasing anxiety or feeling of doom. The treatments available are medications that reduce fluid accumulation, blood pressure medications, medications to regulate heart rhythm, surgery in some cases, and all self-care such as the heart healthy diet and exercise. For more information, I have a list of references such as the Heart Organization, the Cleveland Clinic, the CDC, Emory Healthcare. The images I used were from Shutterstock, clipart.com, and VectorStock. I've also included a program, and I've also included a post test. Thank you.